50.
I think it's 50. Beth, 50, right?
Ooh.
I'm pretty sure it's 50. I'm pretty sure the arc of motion is 70. So what we're going to do, we're going to say to our patient, Shelby, I'm going to check how well you can move your ankle today, if that's okay with you. What I would like you to do, if it's okay, is I would like you to remove your right sock and roll your pants up past your knee, if that's okay with you. If you want me to drape it, I will. Okay, go ahead and lie down for me on your back. Okay, so what we're going to do, can someone throw me a towel, please, like a hand towel or something? Go ahead and bend your knee for me and lift the leg up. Good, man, back, please. Good. Thank you, perfect. Alright, so, as far as I know, landmarks should all be the same for measuring plantar and dorsal, which is kind of convenient for you. What we're going to do is we are going to do the same thing we went over last week, basically, and that is we're going to go over the landmarks. We're going to check passive range, which is where we have the patient relax. Again, the special consideration for the foot and ankle is that many people are ticklish, so you have to be really careful with your hand positioning and the way you mobilize the foot so that you're not causing discomfort or irritation to your patient. The other thing that's important when you're going to test range of motion for the foot and ankle is that if you have the leg flat with the patient in supine and you have them move into dorsiflexion, go ahead and bring your toes up, what may limit their ability to go through the normal range of motion? So yeah, as you guys may recall, relax. The gastroc comes up and crosses the knee, right? And so if we don't put the knee in slight flexion and put the gastroc on slack, most people, even normal people, are going to feel a stretch in their calf before they can hit their true end range. So in order to compensate for that, we put a little pillow under their knee just to kind of block it in flexion, and that should put the gastroc on enough slack where it's not really limiting her ability to do normal range of motion. So that's important, setting it up. So, what I'm going to have you do, I'm going to go ahead and have you bring your toes up towards you, bend through your ankle for me. Good. And again, I'm going to make sure that I educate her, whether it's verbally or through tactile cueing, not to bring her foot out to the side or inside too much. So we're going to try to minimize inversion and eversion. I'm just going to have her work on pure dorsiflexion here. So bring your toes up and relax. Okay, good. So I want you to do it actively. I'm going to use a towel for sanitary reasons. And I'm going to come in, cup the heel, relax. Okay, and relax, release. And I'm going to come in and I'm going to check her passive range of motion. See what she can do. Does that feel stiff or pain or anything?
No, feels good.
Good. So what I'm doing is I've come underneath and I've kind of cupped her heel and I put her toes against my forearm and I'm kind of gently moving her into some passive range. That's just whatever, that's what works for me. I find that this is kind of awkward and it's not as pure. So if I cup the calcaneus, I can bias or minimize the bias of inversion and eversion better. Okay? So, expose your landmarks. Check passive range of motion. Check active range of motion. Put the gastroc on slack. Set yourself up to measure eye level. Okay, my axis. This is tricky. Where's my axis for dorsiflexion?
Distal to the
Yeah, so it's not the lateral malleolus. It's just distal, okay? Just distal. I would say like a finger width down. Just a little bit. Just slightly below, okay? What about my stationary arm? What's it aligned with? Fibular head right here, right? There's a nerve that runs right behind it. Don't poke too hard, but you find it, okay? And then my moving arm is aligned with fifth metatarsal. So a lot of students in years past get confused because I use the middle black line as my reference point, and a lot of students think that they need the black line to actually be to align with the very end of the fifth metatarsal. But not so. You actually just want to make it basically, you're going to have to visualize a parallel line of those two reference points. So you have your line that's aligned with it, but it's parallel. It's not touching it. It's not perfectly in position with it, but it's parallel to it. Okay? So, ideally what you would do, so right now, when someone's resting, they rest in plantar flexion. Okay, so if I want to check her range of motion, it might be easy for you guys to set your goniometer up, and then to have her come up to neutral. Start at a true 0, might be helpful. A little more. Good. So there's about 0. Now, see how far you can go? Bring your toes up towards your head as far as you come. Whoa. That's good. So first I'd make sure I have all my landmarks set up. Then I'd make sure she's not cheating. And I'm going to measure at eye level as far as you can go. And relax. Okay. You have about 15 degrees of active range of motion. Pretty good. You feeling tension back there?
No, not really.
Okay, good. Now, same position. As far as I know, landmarks are the same, right? For plantar? Okay. And again, if you really want to, you can have her start neutral, but since she's already relaxed there, I say just go down as far as you comfortably can. As far as you comfortably can. Okay. And normal's 50. She's at about 67. Okay, and you can visually see that she's going pretty far, right? So she has a deficit going into dorsiflexion, so she might have some tightness in some of the musculature, likely the soleus. When she goes into plantar flexion, she has a little bit of extra motion. So is that clinically relevant? Hard to say. Could she be at a little bit more susceptibility to injure because she has extra plantar flexion range of motion? Possibly. She has a little hypermobility there. But it's up to you to determine if that's significant or not. Me personally, I would give her some general ankle stability exercises, and I'd probably have her work on stretching her calf out a little bit. So that's up to you. Okay, any questions about that? Knee flexion, landmarks stay the same. Watch for compensation, check active and passive range of motion, and what else? I think that's it, right? Measured eye level. Question?
Yes, on the landmark of the fifth metatarsal, are you, I couldn't quite catch whether you're running the center black line up to the base of the metatarsal?
No, correct. That's not what you want to do. Here, you might want to come over here and see this everybody. But basically, when you have everything lined up, okay, let's just say theoretically. So, okay, some patients,
Rush for the top.
I've had some students who think this black line has to literally end at the end of the metatarsal. But what you want to do is you want to visualize as if they were two parallel lines. That's how you reference it. Okay? So see how my black line in the very center is parallel to where that bone would be in the foot. Okay? So I'm not perfectly in line with it, and I'm not pointing my line at the bone itself. I'm literally aligned parallel, as if they were right next to
So
one
right
another.
above it, sort of?
Yeah.
Okay.
Because if you line it up perfectly, you're not going to be right over that fifth metatarsal.
Right.
So all you can do is reference in alignment with it. That's all you can do. Okay?
Okay.
So again, in dorsiflexion, I would encourage you to try to bring them to a 0 and start there for your practice, and then see how far they can go past it. Go ahead. Okay? That's your motion. And then in dorsiflexion, plantar, you can start at 0, but I usually just have people relax to where they can go, and then push further down, and that's their motion. Any questions? We'll practice that.
What about their toes? Should they keep them from curling their toes?
Good point. So that comes more into effect when we do muscle testing because they want to cheat with their toes, especially in dorsiflexion. But, think about it. This is just me personally. If someone moves their toes, go ahead and lift your toes up. It's really not going to change the position of any of your landmarks. So it's not really that significant. However, some purists might argue that if someone engages their toe extensors, that may give them, a little edge into a couple degrees of added dorsiflexion since those muscles do cross the ankle. But so yeah, you can cue them to not do that, but I don't think it's really that big of a deal personally. It becomes much more significant when we do our manual muscle testing. Okay, inversion and eversion. You ready? So I'm trying to think.
Over there.
I don't know. It doesn't matter. It doesn't matter if they're supine or sitting, does it? I don't think it matters. I don't think it does. Personally, does anyone disagree with that? As long as you have your landmarks set up, I don't think it matters. But from what I recall,